Well, I have to talk about the ongoing battle over arthritis and the approaches to dealing with it. I'm still up here in Canada, and there's a write-in article, Dr. K. Komarov, obviously a Russian that defected to Canada. And the question was, what's the verdict on glucosamine and chondroitin? Do they really relieve arthritis pain? And there's, to make a long story short, there's the ongoing controversy. Some studies show one thing, some studies show another, and he's just sort of saying, it depends. It's a toss-up. Try it, but don't expect a whole lot. Well, you have to throw in another factor here. You are not what you eat. You know, that old adage, you are what you eat, is absolutely positively not true. You are what you absorb. And that holds true for chondroitin, sulfate, and glucosamine sulfate also. If you're not absorbing it, it's not going to be effective. And so one of the things I like to do is if people aren't showing results from what we call our healthy bone and joint pack, which is sort of our modernized version of the pig arthritis formula, which came out in the 1990s, I say, look, let's go on a gluten-free diet. Obviously, sometimes when you question people, they have rosacea, they have psoriasis, they have dermatitis, eczema, they have a history of constipation, diarrhea, they have a history of asthma, they have all kinds of stuff, belly pain, bloating, irritable bowel syndrome, diverticulitis, celiac disease, colitis, ulcerative colitis, Crohn's disease, all that kind of stuff, and you know they have a gluten intolerance. Just get them off of gluten and get them on the Healthy Bone and Joint Pack, 1 per 100 pounds of body weight. Now, in 2002, in the New England Journal of Medicine, Harvard Medical School published results of a meta-study on over 300,000 people who had received joint replacements. They said, big headlines, guess what? Knee replacement, joint replacement for arthritis is worthless. It's worthless. That was 2002. And then 4 years later, the same Harvard group, using the same database, only this time they looked at the backs of these people, came out in 2006 in JAMA, the Journal of the American Medical Association. They said, back surgery for back pain, sciatica, restless leg syndrome, degenerative disc disease, peripheral neuropathies, burning numbness, pain, tingling in the feet is absolutely unnecessary. Don't waste your time. Don't do it. And then, of course, just last year, in the New York Times, they had a big article called Medical Tourism. They're listing all the various diseases that people travel overseas because they can get a better job cheaper in other countries than America. And they pointed out that a hip replacement in America costs $78,000. One hip replacement costs $78,000. The same hip replacement using the same device, same surgical procedure, same trained doctors is $13,000 in Belgium, and that includes a round-trip ticket from New York City to Belgium and back in 5 days and a $1,000 a night, five-star high mucky-muck hotel to recover after the surgery. By contrast, for a 200-pound individual, man or woman, if you need a hip replacement and you choose to go with Doc Wallach and the Healthy Bone and Joint Pack, it'll cost you $1,500 over a 3-month period. It's $500 a month for 3 months, and after that, it'll be $250 a month for maintenance. You need the 90 essential nutrients, right? That's for a 200-pound person. So $78,000 in America, $13,000 in Belgium. That includes a round-trip air ticket and hotel stay. And then $1,500 for 2 Healthy Bone and Joint Packs for a 200-pound person, and then cut it down to $250 a month for maintenance because you need all 90 essential nutrients. Well, we always are successful, and I always tell people, look, give me 90 days. Give Longevity 90 days. Give the Healthy Bone and Joint Pack 90 days. If I fail you, which never happens because I've been doing this for 35 years, it never fails. But if I were to fail you, theoretically, you can always go get the surgery, couldn't you? But if you go get the surgery first, you cannot always get uninfected, unsurgeried, unparalyzed, and undead. So why would anybody want to go do the invasive, dangerous stuff first? Well, that's because insurance pays. That's right. People will risk their life because insurance pays for a procedure they really don't need, rather than spend maybe $5 a day, about the same cost as a cup of exotic coffee from one of these coffee things that people go to. Don't forget Java Fit. We're a lot cheaper, a lot better, right? We have the same Arabica coffee as they do. Same stuff. Probably get this from the same plantation, right? And you can maybe be your own coffee baron. Well, anyway, back to the subject, arthritis. Give me 90 days. And we will support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And we're talking about knee arthritis, bone-to-bone. We're talking about osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, rheumatoid arthritis. We're talking about things like ligament and tendon problems, meniscus problems, ACL problems, shoulder problems, anything to do with cartilage, ligaments, tendons, connective tissue, even things like lupus. Get on a gluten-free diet, get on the Healthy Bone and Joint Pack for body weight, 1 per 100 pounds of body weight, throw in 3 selenium twice a day, and lupus goes away. Now, lupus is not an autoimmune disease like doctors say. It actually is caused by a gluten intolerance. You can't absorb nutrients, and of course, if you're doing physical stuff, you're going to wind up with a problem with connective tissue, which includes bone, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, and these are all kind of related. As I say, we've never failed to resolve a person's connective tissue problems in 35 years. And so I urge you to give it a try. Give us 90 days, I say, before you do the surgery. And get a hold of that book, Dead Doctors Don't Lie. Get a hold of the CD, Dead Doctors Don't Lie, and the best of Dead Doctors Don't Lie. You'll be amazed at what you can do for yourself. You can add 25 to 50 healthy years to yourself and your kids and your grandkids just by getting them on a clean diet, get rid of the bad stuff, take the 90 essential nutrients appropriate for body weight, and you'll be amazed what you can do. We can save America together. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have?
I thought we'd talk a little bit about testosterone treatments, as I've got a Fox News story here, headline, Testosterone treatments linked with risk of heart problems and death. Say men with the signs of heart problems who take injections of testosterone or use a gel containing the hormone have an increased risk of heart attack, stroke, or death. And that's from a new study, and they're calling for more cautious prescribing of testosterone. Say in 2011, there were 5.3 million prescriptions written in the U.S. Testosterone is often prescribed to men in order to counteract the age-related decline in the hormone and improve sex drive, bone density, and muscle mass. Lead researcher here, Dr. Rebecca Vigan of the University of Texas, and her colleagues, they looked at 9,000 male veterans who had undergone coronary angiography from 2005 to 2011, a procedure that tests arteries when people have symptoms of chest pain and are at high risk of heart problems. Average age was 60, and were also found to have low testosterone levels during their exam. 1,200 of them started on a testosterone therapy, and the researchers followed them in for an average of 2.4 years after the angiography. And they go on to say that in the study, 26% of the men receiving the testosterone therapy either had a heart attack, a stroke, or died, while 20% of the men who did not receive testosterone therapy experienced such events or died. In other words, the men using the testosterone therapy had a 30% increased risk of a heart attack, stroke, or dying compared to those who didn't use it. Results are held after adjusting for several other factors that could have affected the outcomes. This was all published in the Journal of the American Medical Association. And they go on to say, according to a Dr. Ann Capola, an associate professor of medicine at University of Pennsylvania, not involved with the study, she said, results make us take a pause and make sure that everyone taking testosterone is taking it for the right reasons and is experiencing benefits. Say doctors and patients should be wary of the aggressive marketing used by testosterone manufacturers. And in fact, they say the rates of testosterone prescription tripled between 2000 and 2011, reaching sales of $1.6 billion, that's billion with a B, in 2011, according to a previous study. Wow.
Well, that goes back to one of my original statements in the CD, Deadly Recipe, Doug, where I said you have two opportunities to give your life to your country. One's on the field of battle, and the other's in a VA hospital. Now, low testosterone, erectile dysfunction, is another one of those physician-caused diseases. It's a physician-caused disease because testosterone is a steroid hormone. It is made up of 95% by weight cholesterol. Who told men and women to get on a cholesterol-restricted diet, eat tofu and beans instead of red meat, eat oils and margarine instead of butter, cream, and lard, eat egg beaters and egg white omelets instead of eggs, eat boneless, skinless chicken breast, and take statin drugs to lower cholesterol? Well, low T showed up after that. Before that, American men never had any testosterone problem. It's all because of doctors. It's a doctor-physician-caused disease. And, of course, it developed a whole industry with all these testosterone injections, but also the sex drugs like Viagra and similar drugs. And it's just a big industry that was created by a doctor, physician-caused disease, low T. And I just have to waggle my finger at them. They just go out of their way to kill Americans. American doctors, through these types of things, Doug, kill more Americans each year than the mafia has in 1,000 years. Men, you want to have a greater sex life? Eat more eggs. Get that cholesterol, and your testicles will prove, I don't care if you're 192, you'll produce more testosterone, you know what to do with. And, of course, you can take our GTO, a great natural herbal thing. GTO is an acronym for, you got it, get turned on. Well, stick with us. We're going to be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to West Virginia. And Melissa, you're on with Dr. Wallach.
Hello, Melissa. You're on the air.
Hi, Dr. Wallach.
Hi. What's up?
I have ovarian cancer, and I was wondering, is there anything that I can take to prevent it from not coming back?
Well, we can work at it, can't we? Okay, this is where the medical system falls way short. They'll do surgery, and I'm assuming you've had either surgery, chemotherapy, and radiation, or all three?
All three.
Okay. Well, and what's the doctor's, what do they say at this point?
It came back again, and I'm undergoing chemo.
Okay, another round of chemo.
Yes, sir.
Okay, what do you weigh, ma'am?
I'm about 280.
Okay, and how tall are you, please?
5'5".
5'5", okay. Let's see here. Shar?
Yes.
Okay, how would we help this young lady?
Well, oh boy. First of all, she needs to lose weight, but
well, that would not be the top of my priority list here.
No, she needs she needs the Healthy Start Pack, but she needs to add selenium, and she needs to get her ORIC points over 100,000 with the Cell Shield RTQ or the Triple Treat chocolate, and of course avoid all the bad stuff. And she could take the Fucoid Z because that had 840 studies.
Yep. Okay, very good. Okay, and let me build on what you started. Yep. And again, Melissa, you weigh 2 what?
280.
280. Okay. I would be a little heavy-handed here because the cancer has come back, and so we don't want it to get worse and worse and worse, right? So you're wise to look for something to do. And what I would do, I'd be a little heavy-handed here. I would take 3 of the Healthy Start Packs per month. If finances are a problem, I wouldn't do any less than 2. But optimally, you would do 3 healthy Start Packs per month. That'll be 1 ounce of the Osteo FX Plus at breakfast, lunch, and dinner. 2 scoops of the Beyond Tangerine Nutri-Crystals at breakfast, lunch, and dinner. 3 of the EFA Pluses at breakfast, lunch, and dinner. And as Shar said, I would throw in 9 selenium a day. 3 at breakfast, 3 at lunch, 3 at dinner. That would be 3 per 100 pounds of body weight. That would be 3 bottles a month. That would also, as she pointed out, throw in the Fucoid Z. I'd have you take 5 of those 3 times a day. That'll be 3 bottles a month. And that is to support your immune system when you have advanced cancers or return cancers or metastatic cancers. But also take an ounce of the Ultimate Classic at bedtime, a glass of water. A lot of studies on that. And then I would throw in 3 of our Ocean's Gold 3 times a day, 3 bottles a month because of the sea cucumber in there, which is great for cancer patients. Call us every couple of weeks. Let us know how you're doing. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Arizona. And Don, you're on with Dr. Wallach.
Hello, Don. You're on the air.
Hi, Doctor. You're amazing. I love you.
Well, thank you. You're good, too. How can I help you?
There are 2 questions. One is, what do you use for bipolar or manic depression, Youngevity product, and what do you use for ringing of the ears?
Okay, ringing of the ears or tinnitus is actually easy. This is caused by a squeezing of the auditory branch of the 8th cranial nerve. It represents a osteoporosis of the skull, and the tunnel in which the 8th cranial nerve goes through from the brain outside the skull back into the skull is being squeezed. What happens is you lose the minerals, the bones, regardless of the bone, generates a lot of bone matrix which squeezes that nerve. So this person will need the Healthy Bone and Joint Pack 1 per 100 pounds of body weight, and take the CM cream, put a teaspoon down in each ear with a Q-tip when they wake up in the morning, and again sort of like 3 o'clock in the afternoon. And they can be symptom-free. They can actually get a significant reduction of or a total elimination of that tinnitus or ringing in the ear within 10 to 15 minutes after applying that CM cream down in the ear with a Q-tip, like you're trying to remove wax. And it'll take about 3 to 6 months to get a permanent resolution, because then they will be able to support and promote maintenance repair of all the bones in their body, including their skulls. Bipolar, manic depression, anxiety attacks, panic attacks, all of these types of diseases, schizophrenia, people who are psychotic, all these diseases, ADD, ADHD, and autism, are actually nutritional deficiency of the brain. The brain needs 90 essential nutrients just like all other tissues. So the first thing they have to do is get on a gluten-free diet. They have to get rid of all sugar, fried foods, processed meats, oils out of their life. They have to really, really work on that gluten-free thing. I'd have them get that CD called Serial Killers so they can learn how to deal with that. And then I would have them take 1 healthy heart and brain pack per 100 pounds of body weight. I would throw in the de-stress capsules, 3 of those twice a day per 100 pounds of body weight, and the Smart FX, 3 of those twice a day per 100 pounds of body weight. And very frequently, very quickly, you're going to see a significant benefit. Now, when it comes to the medications, I would not, even myself, I would not reduce people off their medication. If they've been given medication prescriptions by a psychologist or a psychiatrist, I would say, look, after 1, 2, 3 months on this program, you're feeling pretty good. You want to, or even before that, if it's very dramatic, go get an appointment with the person who wrote the prescriptions for the medications and have them begin to wean you off of your medications. Don't do it yourself. Don't, ask anybody else to do it for you. Get the guy who made the prescription to do it. Okay?
Did you say healthy heart and brain?
Healthy heart and brain pack, that's correct. 1 per 100 pounds of body weight.
Thank you very much.
You're very welcome. Get back to us. Let us know how people are doing. We see great results all the time. Okay, Doug, let's go to callers.
How about a break?
Well, I can tell everybody, look, we do have lines open. Give us a call, toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And we'll be back with more Truth, Justice, and the Longevity Way after these messages. Okay, Doug, let's go to callers.
Let's head to Arkansas. And Robert, you're on with Dr. Wallach.
Hello, Robert. You're on the air.
Hello.
Hi. How can we help you?
Well, my question is I have a 2-year-old son that's been diagnosed with epilepsy. He had a seizure earlier this year in April. We had an EEG ran on him that came back abnormal. He had a MRI done later, and that also came back abnormal. We went and saw, we tried some medication they gave us. It's hard to pronounce, maybe the generic form of it. But
what did they see in the MRI?
The only thing they really tell me is it's abnormal.
Mm-hmm. Okay. Now, was the child born normal?
He was a premature baby born at 3 pounds 2 ounces.
Okay. And when did the first seizure occur?
This April.
And the baby was how old?
He was just a little over 2.
A little over 2 years. Okay. Well, to me, I wouldn't call it epilepsy. I would call it an acquired seizure disorder, because epilepsy, you're born with it. And let's see here. Does this child have any other history of problems? Asthma? Any skin problems? Eczema, dermatitis, psoriasis?
No, he doesn't.
Okay, no history of asthma?
No.
Okay, any history of belly pain, colicky baby, bloating, constipation, diarrhea, anything like that?
No, he's been really good there, too.
Really good there. Okay. Well, regardless, I would put him on a gluten-free diet. I would get the whole family, including the dog and the cat and the fish and the birds. Everybody's got to be gluten-free in that household. Are there any other kids? Is this first child or?
This is our last child that we've had so far.
Okay, how many have you had?
We have 2 other. We have 2 other children.
They have no history of any diseases?
No.
No asthma, no skin problems?
No.
Okay, good. All right. At any rate, how much does this child weigh now?
He's also got a primordial I can't remember what the children's hospital called, primordial statured being. He's very small. He'll be turning 3 this week, and he's 22 pounds.
Okay, 22 pounds. All right. Well, I'd give him one healthy heart and brain pack, but at 22 pounds, that's going to last him 3 months. That one set of the healthy heart and brain pack will last him 3 months. Okay? I'd kind of treat him as a 30-pound child, and I'd give him a third of a dose of our selenium. That would be one capsule of selenium per day. I would open it up, make 2 little piles, put 1/2 of that capsule in some applesauce and give it to him at breakfast, the other half in a little bit of applesauce at dinner time. I would also give him a teaspoon and a half at breakfast of the OsteoFX Plus and teaspoon and a half of OsteoFX Plus at dinner time. I'd give him a half a scoop of the Beyond Tan Tangerine NutriCrystals at breakfast and a half a scoop of Beyond Tan Tangerine NutriCrystals at dinner time. I'd give him one of the EFA Pluses at breakfast and dinner and one of the EFAs at breakfast and dinner. And then I would also give him the Smart FX, one Smart FX at breakfast and dinner. That's going to require 1 bottle for 2 months of the Smart FX. And let's see here. I would also throw in some antioxidant points. I would throw in the dark chocolate, the triple treat chocolate. I'd give him 1 piece a day, give him a half a piece in the morning, half a piece at night. That's going to give him 16,000 and some change ORIC points per day. And you might have to give some of the other kids just so they don't feel like they're being left out. But that's going to get his ORIC points up there, help reduce the inflammation in the brain. Also, I want him to eat eggs every day for breakfast, baked sweet potatoes with butter and cinnamon, 1 to 2 poached eggs a day, soft yolks or soft scrambled in butter, not margarine or oils. No oils in his life. That means no coconut oil, no olive oil. If he's going to eat ice cream, he has to eat ice cream. He can't eat the soft serve dessert, which is made out of frozen oils. No cereals, no Fruity Pebbles, no apple juice. Got to stay away from all that kind of carbohydrates and sugar stuff. Okay, and then call me every 2 weeks. Let me know how this little guy's doing. Okay, Doug, let's go to callers.
Let's head to Washington. And Autumn, you're on with Dr. Wallach.
Well, Autumn, you're on the air.
Hi, Dr. Wallach. Hey, I have a question. My husband has essential tremors. He's had it since birth, and nobody else in the family really has it like he does. And he gets along just fine with it, but he would love more than anything not to have it. Do you have anything that can cure him or even come close to curing him?
Okay. Now, does he have any skin problems?
No, he doesn't.
No, he does not.
Mm-mm.
Okay. Does he have any history of asthma?
Nope.
Did he have his appendix out?
Nope.
Okay. Does he have any asthma as a kid?
Nope.
Okay. Did he have any bowel problems? Anything like diverticulitis or celiac disease, irritable bowel syndrome, inflammatory bowel disease, colitis, anything like that?
No, not that I know of. He does complain a little bit about gas a lot and stuff like that, but nothing big.
Okay. Well, I'd put him on a gluten-free diet anyway for 90 days to see if this doesn't help. Get him on a gluten-free diet, no wheat, barley, rye, and oats, no fried foods, no processed meats with nitrates and nitrites, no oils, no margarine, mayonnaise, salad dressing, cooking oils. And what does he weigh?
He weighs about 235.
Okay. Okay, Char?
What's that?
Okay, Charmaine?
Yes, sir.
Okay.
I'm here.
Okay, good. All right. Well, here's a guy with essential tremors, has little tremors, and this has to do with communications from the brain down into the nerves, down into the muscles, and so on. And so what would you do for this guy for a supplement program, 235 pounds?
I would give him 2 healthy brain and heart packs.
Okay, very good.
And then he needs some extra glucogel, too.
Okay. All right, very good. I'd give him, as Char said, I'd give him 2 healthy heart and brain packs. I would give him the 3 selenium twice a day, 3 at breakfast, 3 at dinner. I'd give him 1 ounce of the OsteoFX Plus at breakfast, dinner, 3 of the EFA Pluses at breakfast, dinner, 3 of the EFAs at breakfast and dinner, and then 2 scoops of the Beyond Tan Tangerine NutriCrystals at breakfast and dinner. I would also throw in the de-stress capsules.
Yeah, he needs eggs.
Would that be okay, Char?
Yeah, that would be good, but he also needs to eat eggs every day.
Okay, good. Well, let's have him eat. How many eggs would you have him eat?
235. I would have him eat at least probably anywhere from 6 to 10 a day.
Okay, very good. Nothing fried, but he can have them poached, soft-boiled, or soft scrambled in butter. And then, of course, the de-stress capsules, I'd have him take 3 of those 3 times a day. That actually helps him with the metabolism of the brain and the ability to use energy and get nerve transmissions out there to the ends of the nerves at the tips of the fingers and so forth. And give me a call every 2 weeks, if you would, please, Autumn, and let us know how your husband's essential tremors are doing. Obviously, he should not have high-tech coffee, high-test coffee. We have a great Java Fit decaf coffee. He may want to try that. Also, herbal teas would be good. Peppermint tea, chamomile tea. They don't have any caffeine in them. And then give us a call every couple of weeks. Let us know how hubby's doing. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And, Doug, let's go to callers.
Let's head back to Arkansas. And, Chris, you're on with Dr. Wallach.
Oh, Chris, you're on the air.
Yeah, thanks for taking my call, first off. I've been having some problems with having lightheadedness and dizzy spells. I've been to the doctor in the ER. I went to the doctor, and they thought possibly it was high blood pressure, but I guess maybe it didn't turn out to be that. I was on blood pressure medicine for just a little bit.
Mm-hmm.
I ended up going back to the emergency room where they did a CT scan. They've done ultrasounds and things of that nature. There's nothing growing inside my head or anything.
Okay, good.
I've done EKGs. Seem to have done everything. I can't figure out what's causing it because there's no rhyme or reason.
Let's stop here a second. When you get this lightheadedness, does this occur at any particular time of day, like when you first wake up at 10 o'clock in the morning, at 3 in the afternoon?
Sometimes I'll feel good when I get up in the morning, and then the longer I'm up and around, the worse it'll feel. Other times, it'll bother me in the first part of the day, and then by the afternoon, I feel better.
Okay, what do you typically eat for breakfast?
Sometimes I'll have, like, sausage, eggs, things of that nature.
What do you drink?
Water, mainly. I drink water all day long.
Mm-hmm. Do you drink any juice or coffee or anything?
No, not really.
Mm-hmm. Okay. Well, one of the things that will cause people to get lightheaded, and they've done all these wondrous things with CAT scans and MRIs and blood pressure and all that kind of stuff, can't find anything. So it's going to be a biochemical problem. And so, or nutritional deficiency. And the fact that it kind of comes and goes is better on some days, different times at different days. I believe you may have a blood sugar problem. Have you ever done a 6-hour glucose tolerance test?
No, I haven't.
Okay, get a hold of that book, Let's Play Doctor, from your Youngevity associate, and it'll tell you how to do your own glucose tolerance test. And it shows you curves, shows you a normal curve, it shows you a low blood glucose curve, a reactive hypoglycemia curve. I believe you have reactive hypoglycemia. It would be my highest priority. There's other possibilities, but that would be my highest priority. So I'd get a hold of the book, Let's Play Doctor, and learn how to do the glucose tolerance test yourself. You can get everything you need from a pharmacy without a prescription. Get a hold of that book. You'll see all the right curves and everything. If you have any questions, give us a call, but we'll walk you through this. It'll be very, very interesting. I actually see a lot of this kind of stuff. And so give it a try. Give us a call every 2 weeks, or give us a call as soon as you run your glucose tolerance test. Okay, Doug, how much time we have left here?
We have just about 90 seconds.
Okay, Shar, you got 90 seconds.
90 seconds.
Say everything you wanted to say to America about them living longer and healthier.
Oh, my gosh. Oh, only 90 seconds. So, well, basically everybody needs to take care of themselves, obviously, and don't think your doctor cares more about how you feel than you do, because you are the keeper of the castle, and you need to take care of your own castle and take care of yourself first. When you go on an airplane and the oxygen comes down, they always tell you to take care of yourself first and worry about everybody else afterwards.
How are they going to do that? What basic things are they going to do?
Everybody needs to be on the Healthy Start Pack for their base program, and any other products based on any problems they have. Like if they have a sugar problem, they need to add the sweeties. If they have a digestive problem, they need to add the enzymes. It's real simple. It's kind of like the center of the flower.
In addition to that, how could they add some extra insurance to help prevent against a heart attack?
Oh, take selenium.
Well, there you go.
That's it. Everybody should take selenium, especially where I live. There is none in the soil, so you got to take it.
Very good. Well said. Thank you, Shar. And that's why Shar is one of the 5-star generals in the Youngevity Army to help save America. And she's been with us for about 24 years. And, Shar, what special training do you have?
I had a course in welding. I'm a high school graduate with a course in welding. That's it.
And the scary thing is, you know more than doctors when it comes to health. And it's not scary that you know it. It's scary that they don't know it.
It's scary they don't know. And when you first started telling me I know more than medical doctors do, I kind of laughed. But I know that I know more than they do now, and that's really scary.
Okay, well, very good. We're very proud of you. Keep up the great work. I know you're responsible for about 300,000 people. You work in 17 countries. And if you want to join us, contact your Young Duty associate, and you too can be a general in our Army and save America. Well, thank you so much, Shar. Thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.